ThedaCare runs 5 hospitals and dozens of clinics in Wisconsin. Since 2003, it has applied the Toyota production system, known as Lean, to the way it cares for patients. The results are the envy of nearly every healthcare organization in the U.S. First, these impressive improvements in patient care. Over 7 years, ThedaCare reduced cardiac surgery mortality by 95%. For 3 years straight, the ThedaCare Collaborative Care Unit has had 0 medication reconciliation errors. And over 3 years, the share of patients in an innovative collaborative care unit who were very satisfied increased from 65% to 85%.
What differentiates ThedaCare from most other healthcare organizations is really the way we apply the Lean tools to that. We focus on the progression of care for the patient. Within that progression of care, many processes. Many of those processes have waste in them, so we apply Lean methodology to eliminate that waste. By doing so, we improve the care to the patient.
Second, ThedaCare has achieved dramatic financial gains. Over 3 years, it saved more than $27 million and did so without resorting to layoffs. Over 6 years, operating margin increased from 2.5% to 6%. And in the first year collaborative care was introduced, inpatient care costs declined 21%, making ThedaCare the lowest priced provider in Wisconsin.
The benefit of reducing costs is several things. First off, it reduces our cost structure so we have a better profit margin so we can reinvest in the organization and our people. And secondly, it allows us to not increase our charges to the community as much as we might have in the past.
The process began after ThedaCare recognized that the quality of its patient care was inconsistent, and it wanted to turn around financial losses in some business units. The healthcare organization searched for a manufacturing method to improve results. It found Toyota's Lean thinking being used at Wisconsin snowblower maker Ariens.
What we saw were snowblowers on carts. And what we were able to do was make the leap between snowblowers on carts and patients on carts, recognizing that patient care is really nothing more than a process, just like building snowblowers is a process, and when you add caring and compassion to it, then you actually have high-quality patient care.
Ariens had learned how to build its machines using 1/3 the amount of workers, and it substantially reduced product defects. This improved Ariens' cost structure and saved the company from going under. ThedaCare took the Lean lessons and experimented.
We found when we mapped the process of care out to the patient that 90 to 95% of the process was waste. We also found that about half of that we could remove.
In healthcare, Lean means delivering more patient benefit in less time at a lower cost. For example, Lean helps eliminate waste by redesigning work processes. It minimizes the distances workers travel to reduce patient wait times. At ThedaCare, nurses know where to find medications and supplies and learn to put them back in a designated place.
What Lean does is find those minutes in the day for every employee everywhere where it's waste. They're doing rework, they're doing something that's not really creating any value for the customer or the patient. And Lean really gets in and gets at that waste, pulls it out. That creates additional capacity to do more work. Right? So we can grow the business without adding people.
ThedaCare shares its successes through the Healthcare Value Network. The network brings groups of healthcare organizations together to learn from each other's experiences with Lean thinking.
We like to see other organizations accelerate their rate of improvement. And when people ask us questions, it makes us reflect on our work, and that helps accelerate our own journey. So yes, we give something, but we get something back in return.